Great. And with all of that, I want to thank you again for taking time to be on the webinar this morning. I'm joined on this call by my colleagues, Donna Dalton, the Executive Director of the Foundation, and Ambar Hansen, the Community Relationship Officer for our Expanding Opportunities for Children and Families program in the Twin Cities. And I see one of my committee members for the Strengthening Developing Communities program. There may be others as well, Alice Mortenson, and just want to welcome all of you and thank you for being on the call. And thank all of you for taking time out of your days to be with us this morning. I want to thank OneVillage Partners for agreeing to do this webinar with us. Talking with the team yesterday, they underscored that this presentation isn't about them having the answers, but more sharing their experience and the fact that they not only got through the Ebola crisis, but got through it in a way that they were able to use responses that were grounded in and attentive to the needs of the community. And that there's some lessons to draw on going forward. And so they're going to share with us the story of the Ebola crisis from both the organizational and the programmatic perspective. And then they're going to talk about how that's helping inform their COVID-19 response, again, organizationally and programmatically. So to introduce our speakers, Jill Lalonde is the Executive Director of OneVillage Partners, and she's also adjunct faculty at St. Mary's University of Minnesota in the MA, the Master's International Development Program. She has 15 years of experience in international development and nonprofits in the US and across Africa, Asia, and the Middle East. We're also joined by Chad McCordick, who is in Sierra Leone. He's the program director in Sierra Leone for OneVillage Partners. And he's been developing and implementing community-based projects in rural Africa and urban Canada for over 12 years. And so with that, I want to pass things over to Jill and Chad.
Thank you so much, Danielle, and thanks to the entire foundation for the opportunity to have this webinar, and thanks to all of you for joining us. I'm just going to take a minute to give a really high-level overview of OneVillage Partners on the operational side, and then turn it over to Chad to talk more about the response and tell you the story of how we responded to Ebola, given he was on the response for Ebola crisis and managing this situation on the ground. OneVillage Partners, we're based in Minnesota. I'm here in St. Louis Park right now, and we have our office in Golden Valley, and then also in Sierra Leone, in Bunambu and in Kenema, which are in the eastern part of the country. Last year, we were about $1 million in revenue. We're made up of approximately 70% individual donors, about 20% businesses, and about 10% grants and foundations. And so I'm saying this just to give you some perspective of how we're responding and how that, I think, as we've grown as an organization, our ability to respond and the type of response we have has evolved as well. We have, in the US, 4 full-time staff, and in Sierra Leone, we have 45 staff. And comparing that to during the Ebola crisis, we were about a $500,000 revenue budget with 12 staff in Sierra Leone and 3 staff in the US. So we're quite a bit larger now than we were at that time, though still at that time we're responding in a lot of ways that Chad will tell you about. So I will pass it over to Chad now to talk to you a bit more about the Ebola response.
All right. Thanks, Jill, and thanks to everyone for coming out and listening to this. I guess coming out is not the right word, for staying in and listening. Thanks very much, everybody. So OneVillage Partners' mission is catalyzing community-led transformation in rural Africa. And our vision is we envision the people of rural Africa engaged in building thriving, connected, resilient communities. Now, what this means really is no matter what our projects or programs are, they have to be inspired and driven by the local community that we're serving. So as you can see in our values, we are community-led. We democratically consult with the whole community and involve community members in the design and implementation of those solutions. Disciplined, we measure our projects thoroughly, and we do so through inclusion of community members' views. We're equitable also in that, well, sorry, I mixed it up. We're sustainable, both in the structural integrity of the projects that we're doing, but also in community ownership and use by the targeted communities. And then we are also equitable. We champion gender equity through all of our programs and our activities. So today we're going to talk about how we integrated our values into our response to Ebola in 2014 and what lesson we've carried forward in our response to coronavirus here. And I think like Jill said, one of the important parts of this discussion is that we sort of use this as a community where we can all engage in a dialogue to respond to this coronavirus pandemic. So Ebola in Sierra Leone was quite different to the situation that we're seeing here, but in some ways very similar. In the early days, there was a lot of mistrust and misunderstanding about what Ebola was, and we had kind of like the initial problem with fake news that everyone else around the world started to have. And a lot of the reasons that was happening was that systems were just breaking down around the country. The government communication was sending out mixed signals. They didn't want to spook the investors that were coming into the country, but then they quietly wanted to show the public health NGOs that they were taking it seriously. Meanwhile, the NGOs themselves were misunderstanding the gap in understanding of this Ebola crisis. They were focusing their public education in all the wrong ways. And there was a moment where some colleagues in Kenema, at this point, there were over 100 cases of Ebola here in Kenema. And we reached out to an organization in Freetown, the capital, to bring food aid to Kenema. And they didn't realize that there was an Ebola outbreak in Sierra Leone. And then, of course, medical systems across the country were also falling. The healthcare system in Sierra Leone is quite weak. And when something like this happens, it can be catastrophic. The first deaths were the frontline workers who were not properly prepared or protected. And meanwhile, the only infectious disease in the country, the only infectious disease doctor in the country died very early on. So once it was really that point when the infectious disease doctor passed away from Ebola that NGOs started to take a response quite quickly. But the initial response from other NGOs wasn't particularly effective. In one of the communities that we worked in, some training was done and some sensitization was conducted in that community. And it wasn't particularly effective and started to cause a lot of friction and tension inside the community because their model of communicating the information was very top-down, authoritarian, and didn't engage with community members themselves. So that is something that was spoken of in Paul Richards' book, Ebola, How a People's Science Helped End an Epidemic. And Paul Richards is an anthropologist who's been out in Sierra Leone for several decades and understands quite a bit about the culture. So he stayed in the country during this time and studied how this outbreak changed cultures around it and how those important preventative behaviors started to be adopted. And he said what the Ebola epidemic of 2013-2015 showed was an unexpected capacity for communities and responders to figure out jointly the nature of the infection threat and then to respond practically. I very much wish that we had this book at that time because I think it would have really given us an idea of how we ourselves could move forward during the crisis. So I'm just going to take you very briefly through the timeline of what we went through. So the outbreak started in May 2014, and then soon after, in around June of 2014, government regulations started to come in controlling transportation and meetings, community meetings particularly. So we had to scale back our community meetings and we sent a lot of our staff home. We thought that there was nothing that we could contribute at this point. We thought that, we're not a public health NGO, we need to get out of the way and let the experts come in and run things. And that proved to not be the best move. We tried to make the best of the situation though, and did some capacity building in the head office and do some online coursework. But by this point, the crisis was escalating and we had to make some hard decisions about what to do next. So we had to lay staff off and we shut down our office. And we laid off most of our staff except 2 core staff and some expat staff. And but by the next month, we had to evacuate those expat staff back to head office in Minneapolis. While we were in Minneapolis, we did some immediate donor outreach and did some initial responses there. But it became very obvious to us that more needed to be done in the community as the crisis was escalating, and there was more that could be done as well. We also started to see the immediate humanitarian impacts of this, and we arranged some emergency food delivery, which I'll get into later on. And then as we moved into September, we started to ramp up our community education programs that we had already been doing on a small scale. We rehired more staff, and that took us in through the Christmas and early spring. The expats returned, myself included, and we started to conduct post-Ebola debriefs with these villages. By this point, by about October to November, the worst of the outbreak had moved past our area and into the capital in Freetown. Where we were in Bunabu at this time was very close to the Liberian and Guinea border, so this was like the main entry point for Ebola at that time. But as you know, in that fall of 2014, it moved on to Freetown, the capital, and then on to the rest of the world. So there was still Ebola in the country, but we came back, we started to engage with communities and kind of held a debrief with them about what lessons they've learned, how they could continue to protect their community in case the disease came back, and what we would do in case of a future emergency. And then by November of 2014, Ebola was declared, Sierra Leone was declared Ebola free. So one of the things that was important when we did come back and when we were sort of from that fall when we were expanding our programs was we developed really strict safety protocols for all of staff. Effectively, if there was a situation that demanded protective gear, we were immediately out of there. We didn't need any glory pictures of us in masks or goggles or anything like that. That being said, as you'll see, there's still lots that we could be doing in the background. And then, of course, throughout this time, we were having direct phone calls to all of our staff in Sierra Leone. So either if they were in Kenema or they were in the villages, practically every morning I was getting up at 4 a.m. in my apartment in Toronto, connecting with all the teams out here. And that was really critical to our response as well. On the operational side, some of the things we did were leaning into communications, getting people on board with what was happening. A lot of people were already hearing about Sierra Leone, but what we really tried to do was show what daily life was like in Sierra Leone, but also develop a narrative that was unique and countered a lot of the doom and gloom of the media, but still highlighted and the voices of individuals inside the community. And as I said, also we did kind of individual outreach to particular donors who were more concerned about what was going on. A lot of our donors have direct relationships with folks in Sierra Leone, so it was important to keep them abreast of the situation as well. We also developed some specifically tailored fundraisers. So I'm not sure if you guys know what a Veronica bucket is, but it's basically a bucket with a tap kind of screwed onto the bottom of it. And it's a really neat, simple hand washing solution. Another one you can see here, this boy is washing his hands with a tippy tap. We really got creative with all sorts of different tools and techniques that we can get out into the field as quickly as possible. And we use that as sort of a way that people could fundraise, like buy this many hand washing stations for this particular community, and then provide some background on that also. And then also when we did the emergency food delivery, we really tried to make sure that people were aware of it, that they understood what was going on quite clearly. And then we also took the time to improve our programs, tighten up our frameworks, and write new curriculums also. So no one really had any downtime during that. And then for our particular response, our first step was to engage the local leaders. We reached out to paramount chiefs and all local leaders down the line, but we also reached out to women's leaders and traditional birth attendants. And these were roles that were basically outlawed by the Ministry of Health before we got started. They wanted to encourage people to go to a clinic, but these women still had a lot of sway, and a lot of people depended on their wisdom. So it was important to make sure that they were brought on board in educating community members also. We also kept a network of educators and volunteers across all of our operational communities. We sent out phone units to all of them, so everyone had their phone topped up, and we could easily keep in touch around this network. So we were trading tips on how to better communicate education on prevention, inside information on cases in villages nearby, and more. I mean, even just debriefing, how are people feeling about this was critical as well. We also developed, like I said, we tried to get really creative with our emergency response. There was one community that was locked down for about 6 weeks. They weren't able to leave their spot and go to their farms. So what we did was in dialogue with people inside the community, we developed a safe way that we could deliver food to them. And it meant that we delivered the food, and then we called the household heads one by one to come and take their food and go back home with it. So it meant that there had to be kind of like a dialogue going back and forth. And of course, making sure that we maintain those safety protocols that I talked about. And then we also delivered more of those hand washing buckets throughout our district. Once Ebola had moved on and the situation kind of got worse in the rest of the globe, our communities were safe once again. But before we just jumped right back into our normal programming, we started to rescale. Before we rescaled our operations, we needed to make sure that we held public consultations and community dialogues about the Ebola response, not just as a way of solidifying a lot of the learning that was done around hygienic practices, germ theory, and so on, but a lot of these people had lost family members and needed a moment to really grieve about this and debrief. And it was very, in talking with them, it was a very moving experience, the way they described what Ebola was and how it affected each of them. And so it was really critical that we did that in such a way that we respected what they had gone through as a community. When we did rescale in the country, we already had several different scenarios of how we could scale up prepared. When I arrived in the airport in Freetown, I remember actually running to the airport, and the airport in Freetown is very low key and kind of run down. Danielle can tell you about that. So what I was really doing was I was trying to run to beat all the other passengers so I could get through customs first. But I like to say we really hit the ground running in literal and metaphorical terms. And we had also kept in contact with all of our laid off staff throughout the outbreak. So we were able to easily find them, easily bring them on, show them. We had to switch some roles a little bit, but basically we could get going really quickly on that. And then also throughout this, we kept the board informed about how we were scaling up, and we were immediately talking through the board about what the needs were as we were seeing before we just jumped right back into our traditional programming. Now, we've taken a lot of these lessons and we've adapted to the coronavirus with that. So once again, we're starting educational meetings with key community members and local leaders. We're really emphasizing simple and straightforward messaging. Fake news was a problem in the 2014 outbreak. It's an even worse problem now. We're not trying to go toe-to-toe with each fake news rumor that they hear. What we're trying to instead is focus on the medium itself and get people to think more clearly about where the message is coming from and what sort of messages they can count on. We do role plays, particularly around social distancing and how the droplets spread. And you know, these are communities that don't know how to social distance or have never really had that concept. And that's something I'll talk about in a little bit also. One of the more important things that we do is, I think, we do public declarations of prevention and interconnected well-being. And by this, I mean, we get all of the people that we're training in a circle and we ask everyone to think about that person in their life that they most want to protect from the disease. And so they might say my mother, who's very elderly, or my son, or my wife, and we ask them to name what one activity that they'll do to protect that person. So I might, you know, wash my hands every time I come into the house to protect my mother. But then the next person in the circle will say, I am going to protect my son by calling the hotline when this person gets sick. And I will protect Fode's mother by washing my hands when I come in. So what we're trying to do here is get everyone to publicly declare that they're going to do something serious about this disease, but also really enforce that in public health, everyone's well-being is interconnected. It does not matter how much you've made sure that your own house is hygienic and your own family is adopting all the preventative behaviors if your neighbor isn't doing the same. So it's a really good message to emphasize, particularly in a communal environment like Sierra Leone. And then finally, we set up some times to create a community-led action plan. What happens when you have a person come in who displays all of these symptoms of coronavirus? How are you going to protect people coming in and out of your village? What are the steps that each of you are going to take? And that's been a really effective tool to use, especially. So thanks very much. This is all of our information that I encourage you guys to go and check out, you know, in due time, obviously. But just to get things started off, I'll go through some of the questions that were included in the email, and I'll try to answer them very succinctly and then open it up to the rest of you guys. First of all, how do we keep our staff safe and deliver services to our communities who desperately need them? This is a great question, and I think it's one, I mean, even today I had a discussion with some of our field staff, you know, how do we respect the lockdown that's in place right now, and get information out to communities while keeping safe. So we made mistakes early on, and like I said, we thought that there was nothing we could do because, like, what do we know? You know, we're just like a nice community-led organization. We should get out of the way of the big health NGOs. But what we realized is there's always a role for organizations to play. It doesn't matter what sector you might be in. And we also realized very quickly on that they don't know what to do either. A lot of times, I mean, you know, I think both cases was an unprecedented outbreak that nobody had seen before. So we have to, a lot of times, you know, we have to recognize that we're all trying to creatively come up with solutions. So I think if we were to do it again, we would not be laying off our staff. What we would be doing is looking at which core staff we can keep these programs moving forward and look at ways that we could keep some of those staff who aren't as necessary supported somehow and maybe shift their scope of work a little bit. And then also the other thing I would say would be the creative dialogue with target communities. During Ebola in Pujihun, the community that we delivered food aid to, it really was a dialogue back and forth. It was how do we keep our own safety paramount, but also make sure that they can access the food. But then we also had to look at contact the authorities, like how far outside of the community were they willing to let the community members come? How could we do this with their feedback as well? Moving on to another question. How does an organization make long-term plans when they won't know what they may need long-term? I think the number one thing is funding from an agency like Mortenson is key. You know, our funding with Mortenson is not directly tied, and it meant that we were able to shift very quickly from doing basically a lot of what we were doing was adult training, financial literacy programs, and WASH projects in various scales. But we were able to completely turn that around and get really focused on community-based education. So I think the other thing is trying to be creative, like just throwing crazy ideas out there, and really knowing, not doing any crazy ideas, but knowing what's in your wheelhouse, what are your values, what are you already good at. And we already knew that we were good at developing those core relationships inside those communities. We knew that we could rely on those. And then, of course, another thing that we did was experiment. Like I said, throw crazy ideas around, but know what you're good at, know what your strengths are, know what your values are. We definitely tested out approaches that failed, and then fortunately we were really able to adapt and learn from them. Originally, in the very early days, we had a town crier go through the communities on their loudspeaker saying Ebola is real and it's coming, which wasn't particularly effective, and it was also terrifying. And what we learned from that was that people really need an action-oriented thing for them to focus on. They don't need to be passive recipients of information. If you're following up your education with an action plan, this is happening, protect your family because of this disease, here are some things you can do. That's a way more effective way of communicating with your target community members. If the organization engine has slowed down or even stopped, what needs to be in it to fire it up again? So I think I would say dialogue again. What does your targeted community members say need to be in place in the first place, right? Our assumptions were a little bit off after we came back during Ebola, and it was important that we have those debriefs and dialogues with our targeted community so we could learn from them about what they needed right now. Keeping donors and board members on board through the journey as you figure this out. I think it's critical that we don't kind of exude this this aura of already having this under control. And I don't think anyone in the world buys that right now, particularly in this pandemic. But having them on board meant we could keep them really in real time up to date about what we're doing. And I think they really appreciated that and gave us a lot of latitude in how quickly we scaled up and how much time it took before we got to the regular programming. I think, one of the good news about this uncertainty is that we're all uncertain together. And like now is really a good time to be building networks and sharing our approaches, really starting right now. Particularly like what are other like-minded organizations doing? What are other organizations, I'm here in Sierra Leone. I think there's a lot I'm learning from other organizations in sub-Saharan Africa, but also around the developing world that are taking community-based approaches to this. Then this is a tricky question. How does social distancing work in places where close communal living is a part of the cultural and economic reality? I don't know. I really don't know. I think there's an article that came out just recently by Paul Richards, the anthropologist that I mentioned before in the presentation, and he talks about the anthropological study of proxemics, which is like how does a society view a body in public, and how do assumptions change about that. So I think it's some real core deep work that needs to be done in our in our approach. What community members have really focused on, and that was the case also in Ebola, was making sure that they registered and knew who was visiting the community. They erected little kind of like makeshift barriers, and the youth of the community made sure that they were following up on any people that were coming in, and if there wasn't a direct connection or that person didn't have a family member to meet with or something, they would shoot people away. So there's maybe an answer could be in distancing communities from each other. There's also that. One thing that we in dialogue with communities developed was sort of an approach that other NGOs tried out to quite a bit of success, which was developing an add-on to the health unit in a community that was a designated place where someone who was exposed to Ebola but wasn't yet developing symptoms and needed to be isolated and under observation, developing an area where that person could comfortably be. That wouldn't mean they were quarantined to their house. That would mean that because once those people developed the symptoms, that meant that the whole house had to continue to be under quarantine while that person was taken away, and then the disease just sort of spread within the household. And a lot of people still, like at the time, people were calling it the family disease, because effectively Ebola would present in one household and just burn through the whole house and affect everyone there. And then I think basically the best thing I can say about this also is like encouraging dialogue with communities. I mean, we've already started to do this in our own communities. And I think encouraging dialogue in forums like this that are put together, and how we can best learn from each other on this. So thanks very much. I'm going to open it up to questions. Once again, I'll get back to our branded advertising slide right there.
Thank you, Chad. That was just fantastic, and thank you, Jill. We want to move into question and answer now, and you should feel free to type in the chat box, or you can take yourself off mute and just ask your question. I can get us started with a question that is in the chat box from Merritt Michelle. With emphasis on technology to connect how organizations are dealing with gaps in internet and computer. Okay, with emphasis on technology to connect how are organizations dealing with gaps in internet and computer access. Many clients do not have adequate internet or computers/tablets.
Yeah.
So Chad and Jill, you might be able to respond to this, but others on the call might also be able to respond. So please go ahead.
I think this was an issue because some of our communities don't have good cell phone access. And there were some of them who had to kind of like take a bicycle to a nearby hill and stand on the top of it and do that. At that point, we were looking at ways that we could communicate to communities. So if the community was under a lockdown, we sort of used that safe space to communicate with them and found that kind of neutral area where we kept far enough distance apart. I think Ebola was a different kind of disease where we could have that. It's a little bit more complicated right now with coronavirus, so we don't know we're not quite sure how easily things can spread, and being symptomatic versus asymptomatic and all of that. But yeah, I think that's an ongoing discussion.
Thank you. Other questions? Feel free to take yourself off mute if you want to ask a question.
I'm going to stop sharing my screen also, because as long as I'm sure everyone's gotten our website and social media drilled into their heads. So.
I have a question about just wondering about like travel bans happen, you know, when there's a pandemic or epidemic that's happening. And you mentioned about being able to, people had to leave Sierra Leone and come back to the United States. How were you able to go back?
Yeah, well, I don't know. I made a joke around that time that we left when it went from very bad to terrible, and we went back when it was terrible to very bad. We thought for a few weeks there, we were convinced that there was like a mass exodus of NGOs sending their workers back home. We thought all flights were out of Sierra Leone were going to be canceled. That never happened. So we were able to, like when we went back, this was like August when we went back, and we expected to get, you know, coming from Sierra Leone, we expected to get stopped at the gate, taken to a special room and like swabbed down and asked a bunch of questions and put into quarantine. And it was a little bit scary, but we just like walked in and we're like, oh, I guess it's not a problem. But then coming back, obviously, I don't think at that point, flights were still moving. So it wasn't, honestly, there were a lot more rigid protocols that were in place when we came back about taking temperature and writing down where you're going to be and who to contact if you have any symptoms. Right now, we're in a different sort of situation. The government's basically closed all the land borders and not allowed any flights in or out. And they've done this for about 2 weeks back. So I think that was also a critical kind of decision because we had to, you know, check in with our expat staff and be like, who needs to be here, who doesn't need to be here, and who wants to be home. And I think, you know, that can also, and that's also, we're about to go into a little bit more travel restrictions in here internally. We're not fully locked down yet, but there's some internal travel restrictions. And we're also encouraging people like, look, if, you know, really checking in with where they're at emotionally, like where do you want to feel safe? Because a lot of people, the place where you think they are the safest may not be where they feel the most emotionally safe. And that can change very quickly. We had to like mobilize a flight out for an expat. Like the expat came to me and was like, look, I don't know how comfortable I'm feeling being here while the epidemic is raging back home. I said, okay, well, let's have a conversation with that. Like 2 hours later, we got the notice that all flights are being canceled as of 2 days from then. So thanks to Jill, we were able to mobilize flights out. But I think a lot of that is looking at what you're capable of and then also just checking in with your staff and who needs to be where. And another thing I talked about with the expats that did stay was like really question, where can you do the most good? So where are you feeling the best, but also like where do you feel like you can make the most positive impact? And for some people that meant staying out here, and for others it meant being back in the States and like supporting from over there.
We have another question. Was there a need to change your scope of work when you returned based on the changing needs or priorities of the communities?
Not the scope of work. I think we changed what we prioritize. I think we were, a lot of communities we thought we needed to get back into more training and a lot more kind of, you know, a lot more consultation, but honestly, a lot of community members were like, just get us back to work. Like we just want to, there were some projects that were kind of put on hold. And as we sort of started to assess the scene and, you know, scaled up again, community members were really eager for us to get back to work. But then also there were things that we realized that we needed to keep prioritizing throughout all of our programming, and that was basically around like hygienic education and germ theory and so on.
Can I jump on with a question? It's really inspiring to hear that OneVillage Partners came through the epidemic with a solid work plan in place to even double their scope, budget-wise at least, right now. So that's really inspiring to hear that you survived and continue to thrive. Was there ever a time that you felt you may not make it through, that you were considering not having OVP as an entity anymore? We've heard from some partners that they are uncertain if they will make it through. So from your experience, it may provide inspiration or even real life examples of making it through and thriving.
Sure. I mean, I think that I can't really speak to what conversations were happening at the executive director and board of director level about all that. I think there was a real fear though that this would, like for a while there, it didn't look like this would stop. And that was really scary. It just looked like it was growing and growing and people kept dying, and it was quite scary to think that like it wouldn't just mean the end of our OVP programs, it would mean the end of a lot of day-to-day life in Sierra Leone. And that was a very real, like that fear was very palpable. So I can't really speak to the organization as a whole. I do know like we were able to kind of, by engaging our donors directly on that, just so you know, like Jill's not jumping in on this because we had a different executive director back then. It's not that she's like, well, I don't remember. We had a different executive director back then. But yeah, I think keeping, doing some direct donor engagement was really helpful for us, and then showing how we were pivoting and how this was vital. And I think particularly it was, as you know how it is with, international organizations and white privilege and all of that. I mean, as soon as Americans started to get this disease, America started to pay attention. And for us, for those of us who've been living through this for a good 2 months and just, losing sleep and feeling like a certain amount of like trauma from this, it was like, oh, of course, now you're paying attention. Now you're gonna set all the protocols when Americans are getting it. But I think that timing coincided with like, as it became kind of like a topic of conversation, we were able to really capitalize on that and, brand differently. But yeah, I definitely, there was a lot of like times where we're like, we don't know, like, I think we got used to not knowing what we were going to do next, and just got used to thinking that this may not end anytime soon. And definitely from my own end personally, I'd wake up in the middle of the night just like furious with myself that I was able to be, safely in a tiny dingy apartment in Toronto where I didn't have to fear Ebola. And I felt like that kind of from my own end personally, that sort of drove me a little bit, that when we did come back, that's part of the reason that I was hitting the ground running, because I was like, I've wasted so much time, let's get back to work.
And I can share an observation. It is in hindsight, as Chad said. I started with OneVillage Partners in 2016, about 4 years ago. So we were already kind of back up and running after the crisis. But First, 2016 was a record fundraising year for us. And what I saw in that and heard from people is, just a huge sense of community that people want to help. And something that I keep voicing concerns with and keep kind of getting a response that I think has resonated with people since the Ebola crisis is how do we keep global causes relevant right now to our donors and key stakeholders? Because everybody's very rightly concerned with their own families and communities and what's going on locally. And I think it is a really valid point that people who are globally engaged understand the importance of the interconnectedness that we all have around the world. And that will, should give us some hope that people will continue to see the importance of supporting international work and want to continue international development to thrive. And that, of course, every situation, every crisis is going to be different, but that there is a huge sense of community and donors are very loyal and they want to see us succeed. So I've heard a lot less, like as I'm voicing this anxiety about it, I'm hearing a lot more optimism about, what, this could be a blip in the road and we'll get right back to it.
Jill, maybe related to that, could you repeat, I think at the very beginning you talked about the size of your budget now and the size of your budget then during the Ebola crisis. It's just maybe helpful for folks on the line to kind of be reminded of your size and, kind of link that with your ability to rebound.
Yeah, it was, I think 2015 was about $500,000. And 2019, we finished just over $1 million. So we have, come back and rebounded and grown significantly since that time.
Are there other questions? Well, I want to thank you so much for sharing, Chad and Jill. It's just really helpful in this moment. It's inspirational and instructive. And so thank you for taking time to share with us. I want to let folks know that we are recording this. We're going to make the recording available on our website. I'm going to ask if we can distribute the PowerPoint that was shared today, just so folks have that information to move forward with. And we'll send out a survey. Just would love to get your feedback on today's webinar and also thoughts kind of moving forward around what you need. Before we finish up, just see if there are any other comments or questions.
Yeah, thank you, everyone. Thanks for checking in and listening. And I really, I meant what I said earlier. Like, I think it's important that this sort of opportunity, I'm really grateful for this opportunity to share what we learned, but I think like these kinds of forums are great for all of us as we're moving through this this pandemic, this really uncertain time that, I think we're a community here also.
Yeah.
I don't want to take up too much more space, but I do have one other question. You had mentioned that when you started the programs again, that you had to make space for community to grieve. Not only had they lost family, they had lost that sense of community for a while.
Yeah.
I think many of the organizations, whether they're working in international communities or in Minneapolis, St. Paul, they are a hub of strength for many families. And during this time, they are not as connected to those hubs. How did you make space for families and community to grieve that was effective for them to grow from this experience?
Yeah, no, that's great. Well, we had our model has core volunteers from each of the communities sort of working directly with us. So we always had a little bit of a presence there, and we were always hearing back from them. I mean, whether it was our staff based in Kenema or out in the field, or even me back in Toronto, I was on the phone with some of them. And so we were really kind of checking where they were at throughout this time. We also developed a sort of a program effectively. One of our staff who's still with us developed a little bit of a role play where the whole community was invited to come out, and we kind of went through a little bit of a recreation of what would happen if someone was to come into their community sick. And I remember in one community, everyone they laughed, they thought it was funny, but they took it really seriously. Like, and in one of them, a woman stood up and was like, "This is what happened. If we had thought of this beforehand, we would never have had Ebola come into this, into our village. And if we had taken these steps earlier and listened to the education that was being provided, we would have been, many more of us would have been here right now." And it was really kind of a moving moment. And yeah, I think, I don't think it was just, I mean, there were several interventions around that, but that was kind of like we really encouraged the whole community to come out. And this was also like, at this point, we were the only NGOs back in the field doing this too. So I think everyone kind of came out just because they wanted to see what was new and interesting about it. And everyone, contributed something to it. And at the end, in one community, they asked me to talk to people, just briefly tell them about what was, talk to them about like OVP and how we're still working with them. And I mentioned that, people around the world knew about what was going on in Pujo and knew that we had been delivering food and helping to make sure that Ebola didn't come back to them. And they were really happy to hear about that. And I said, even when Ebola had gone to other countries and to America, and there was this huge gasp in the community center, because none of them knew that Ebola had traveled all the way to America. They didn't know that America also had cases of Ebola. I mean, very, very contained. And it felt like in that moment that something that they were dealing with was that communities around the world were also dealing with. And that was shocking to them, but I think it was an interesting conversation too, because it showed, like coronavirus is showing us right now, right? Like, the world's very globalized, and now more than ever, all of our well-being is interconnected. So yeah, I hope that answered your question.
Thank you. Just pause for a second before we finish up to see if there are any other questions. Well, and just huge thanks again, Jill and Chad and everyone for being on. And we'll be in touch, and please everyone stay healthy and stay safe. Take care.
Bye-bye.
Thank you. Bye.